Hi folks, my name is Svarupa and I'm a German speech and language pathologist, and I'm currently making videos about some symptoms in the mouth, in the orofacial muscular region. I do those videos in German, and I'm just interested if how many people I could reach if I could provide those information video to a more international audience. Yeah. So what I wanted to talk about first, because I think it's the most the most important and the most widespread matter according to pronunciation and the muscular tension in the mouth and in the tongue. So please excuse my accent. I'm German. I wanted to talk about that because you can see that in very, very many people, especially if you go on social media. I see so many people with a lisp, and it's just not nice. It doesn't look nice, and it doesn't sound nice, and many people aren't even aware of it, or maybe they think they're too old and it's not worth having it treated anymore. So there's a lot of stuff that you could do actually at home to treat your own lisp. So, and in English, it's even a bigger problem, because in English you actually have the th. I said it wrong now on purpose, but in English language you actually have that sound. Yeah, you have that kind of an S sound that is pronounced with the tongue between the teeth. In Germany, that's totally wrong. We don't have that S sound. So you have it, but that is a bigger problem, because that means it could using the wrong sound, like using th or using an S that is pronounced like this instead of a normal S, could lead to misunderstandings in communication, because it could lead to a shift in meaning. Yes. So maybe if you say to or thu, it could make a difference, right? I mean, that was a bad example. I can't think of anything now, but you know what I mean, right? So changing S with th could eventually lead to a change in meaning. In German, we don't have that sound, so it's obvious. Everyone saying was just intending to say an S. But in English, you don't know that. In English, it could also mean that children, mostly we have those problems in children, but also with grown-ups. That's why I'm making those videos. In English, you don't know, is this person or child just not able to say a proper S because of the muscular malfunction, or does he really not know when to use S and when to use TH? Yeah, this is a totally that will be a totally different underlying origin of the problem, right? Because it would not be the muscles, the missing or a lack of muscular tension, or a lack of moving, a lack of the ability to move the orofacial muscles properly, but it would be a lack in knowledge of how to use sounds and letters properly. So what can you do? Mostly a lisp, people have a lisp because the muscular tension in the tongue is too low, the tongue is too weak. And you can see that also because many people who have a lisp, they speak like, I can't copy that. You can just see when they speak that the tongue is kind of always a bit like that. So when they open their mouth when speaking, it's not like this. Yeah, like you see, it's behind my teeth. It's almost touching the lower lip, so it also doesn't look that nice, but it it obviously doesn't sound so nice. So the first thing you would have to do is, if you have a lisp, you must strengthen your tongue. So do everything that strengthens, that's a difficult word for a German. Try to strengthen your tongue, right? Do drink often from straws, because the sucking also brings the tongue a bit back, and you must really build up high tension in your tongue, and that makes it stronger. So drink from straws daily. Try to drink from straws. Try to drink thicker consistencies from straws. Drink a yogurt through a straw, or a very thick juice or so. Drink from straws many times, and I recommend drinking water, not something thick, but drink water from a straw like this. It's very thin. That means the mouth must work and suck a lot. It must build up really high tension. That makes the tongue and the lips stronger, and it brings the tongue a bit back, because the tongue slightly goes back when sucking. Yeah, also try, when you can, when you're good in drinking water with that, try to drink like that. With open mouth and open lips. That way the tongue must be at the place where it's actually supposed to be. For children, we call that the sleeping place of the tongue. It's up on the gums, at the gums, directly behind the upper front teeth. That's also where the tongue is supposed to be, always when your mouth is closed. When you're talking, eating, okay, the tongue is supposed to move. But when we just sit around like that, doing nothing, reading, sitting at school, watching TV, the tongue is not supposed to be like this, or even like this. No, the tongue has to be up, at the gum, up there, right behind the teeth. Like there, but not pressed there. It's super smooth, like without force, right? So that's also one thing that you should try to do. Try to keep your tongue up there, at this spot, when your mouth is closed, when you're doing nothing. Put like stickers in your room, in where your eyes go many times, so where you can see them many times a day. That should remind you to keep your tongue there. Start maybe with 5 minutes a day, then make it longer. You must bring your tongue back, right? People with a lisp usually have a super weak tongue that is always, it's always a bit too far in the front, right? So you must not only strengthen it, you must bring it back in general, right? By thinking about it a lot, drinking from straws, strongly sucking through these tiny hoses. You must look them up online, like drinking hose or drinking tube or little rubber straw. I don't know how it will be called in English. And those are the things that I would recommend you to do before you actually try to do real pronunciation training, right? If you did that, I could give you a bit more advice, as in how you could actually practice saying, pronouncing the S properly and without it hitting the teeth. But first, you should try to make your tongue and lips and the muscles in your face and tongue, to make them fit and strong. Thanks for listening.